Welcome once again, Dr. Roy Thomas.
So good morning all. A warm welcome to the 5th anniversary of Ifph. I am Dr. Roy K. James, an MBBS DGO graduate, now pursuing BHMS at Government Homeopathic Medical College, Kozhikode. So first of all, before I begin my session, I should appreciate the previous speakers who presented in the dais, especially Dr. Kanchan. A phenomenal work, I must say. A kind of research the modern medicine world would look at. A recognition for homeopathy, definitely. A big round of applause, she deserves it. So I am here to talk regarding a similar topic, the relevance of homeopathy in the modern world. Homeopathy is a pseudoscience. Homeopathy is placebo. Homeopathy is slow to act. There are a lot of ethical and scientific controversies around the world regarding homeopathy. And a few to state is the scientific theories of homeopathy, especially the ones who say like the similia similibus curantur, the miasmatic theory, the factors of ultra dilution, the antiparticle state, and especially the pharmacodynamics like the drug standardization, the drug proving, and even the healthcare economics, which includes public funding withdrawal in many countries. The insurance coverage claims are neglected, are not given for the homeopathic treatments, and resource allocation is very, very less compared to the modern medicine. And again to say, the theoretical challenges are the placebo effect, where again the ultra dilution of the medicines, the very negligible amount of medicine which can't be detected with the present technology, and the absence of the modern investigative modalities at the time of its inception. And even today we are following the same theories, the 18th century theories, the 2-century-old theory even now, and the absence of a plausible mechanism for explaining the mode of action. So when you compare it with the modern medicine, it's like the modern medicine pharmacology is limited to biochemistry only. But homeopathy, its action spans across the physiological pathways, the biochemical reactions. Even it can alter the anatomy and the most important thing is that it can affect the somatic as well as the cognitive plane. Even it has got its action in its mind of a human being. And the statistical models of drug proving is the hallmark of modern medicine. See, the modern medicine treats the human body just like an engineering marvel. Across the world, across the continent, the same drug is used for treating a same disease, particular disease condition. It's the same. It's like treats the human body like an engineered model. But homeopathy, in contrast, treats the human body as a dynamic system, an interconnected system of complex physiological biochemical reactions, and it brings out the cure. And the concept of agent, host, and vector interaction is much more relevant in a holistic system of medicine like homeopathy than the modern medicine. And homeopathy focuses on treating the cause of the symptom, but modern medicine always tries to treat the symptoms and alleviate the patient only for a short duration, giving only a temporary relief. So the cure, it can only be given with a holistic system like homeopathy. So, but why homeopathy is still lagging behind? It's because we need more technological advancement to elucidate its mechanism of action, to elucidate the presence of the drug substance in our medicines, and only then we can advocate for its action in the human body, in the materialistic plane, to the scientific world, and only then they will approve of it. And again, in our system, there is no fixed remedy for treating a specific disease condition. That again makes the scenario more difficult, especially when the modern medicine has got drug of choices for all nameable diseases, and it's a kind of a standard medicine that would be advocated to all patients across the globe. But our system is in stark contrast to it. It has got its action in the dynamic plane, and hence there is no fixed medicine for a specific disease. And that should be the working model. But again, that gives us a backlash, and even the lack of awareness among the public and even among the physicians of other systems is again a drawback for our system. The lack of standardization in evidence collection. The evidences put forward in the modern medicine world, they are unquestionable, and the evidence is put forward by the physicians of our system. It has to be more relevant, more scientifically plausible, and more digestible to the scientific world. And we need more systematic observational studies, especially when our drug proving is based on the cognitive planes and also the observations of the patient, the subjective and objective symptoms upon the exhibited by the patients. We have to keenly observe it, and we have to bring in more studies focused on these particular things. So this is a study by Times of India, and here we can say that the study was conducted by CSIR and Government Homeopathic Medical College of Bhopal, and it says that our homeopathic medicines has got unique electromagnetic waves and it excited in up to a certain potential. Our system of medicine, homeopathy, has got a robust historical and philosophical legacy. See, the historical foundation built by our pioneers, we have to get in sync with it, because our existing modern medical investigative tools, we have to make use of it, and we have to get in sync with the 18th century theory that we study and propagate. The Hering's law of cure is a wonderful example for the same. It states how the disease progresses in its affection, and when we administer our medicine, how beautifully it gets cured. If you look at it in an embryological point of view, the disease starts from the neuroectoderm, progresses to the endoderm, the mesoderm and ectoderm, and when you administer a homeopathic medicine, it reverses in the same order. The same order from the ectoderm, the mesoderm, endoderm to the neuroectoderm. And that's what Hering's law is all about. The vaccination of the modern medicine, it wouldn't have worked if a similia similis curantur was a fallacy. It's all about treating the same things, the similar things with the similar medicine. That is essentially what is vaccination is. And that is the most important stronghold from the modern medicine side that supports the homeopathic theory of similia similibus curantur. Then the legacy of our system, it's rooted in giving quality care and improving the quality of life of our patients. It's not just symptomatic relief, it's not just temporary relief that our system of medicine advocates. It's always the proper cure, the gentle, permanent cure that is given by our system. And the core principles of our system, it's like the like cures like, and even in the ultra dilution that is brought about by succussion, and the cardinal principles of homeopathy combined, abridged with this proper, beautiful system of medicine bring in a beautiful chaos. So this is the global popularity of homeopathy. If you look at it, you can see that almost 5 million US adults use it. Almost 5 million US children also uses homeopathy. Even in Switzerland, the 8.2% of its population still uses homeopathy. So in the US, when you see, there is 2 regulatory bodies. One is the FDA. The FDA, it approves the medicines, drugs, whatever is sold in the US, and it considers homeopathic drugs as medicines, but it doesn't approve of its efficacy or safety. And even the Federal Trade Commission states that homeopathy should bring forth more scientific validations regarding its efficacy and safety according to the modern principles. Means they want the materialistic evidence that could be given to them. So this is the role of homeopathy in an integrated and holistic care. It individualizes the patient. It gives a person the whole person focus, where the somatic and cognitive planes are treated by our medicines. The complementary role is the most important of among this, because Hahnemann never thought of it as a separate system. It has got a complementary role. See, in case of acute emergencies and all, definitely you need the aid of modern medical amenities to to make the patient survive out of the sudden derangement to the life, and we need to give the supporting life measures as an emergency care. And the integrative setting has to be brought forth, where we have to combine both the amenities of modern medicine and the medicines of homeopathy. So I would like to present a few cases, 3 cases, very short cases regarding homeopathy, which I have closely observed in my family's clinic, both of my mother and my 2 brothers. So this is a case of cleft palate and cleft lip, along with a left-sided choroidal cyst. So this patient presented at 21 weeks of pregnancy, and the fetus was in intrauterine state at 21 weeks of gestation, and this is the 33 weeks scan, and you can see that the patient choroidal cyst has disappeared, and even it doesn't say anything about the cleft palate or cleft lip. And this is the baby at birth. There is only a bifid lip. You can see there is a bifid lip for the baby at birth, and this is the photo after 1 year. 1 year without any surgery, just pure simple homeopathic medicine. This is the result. Modern medicine can never dream of such a thing. So the case of adenomyosis that was reviewed by me, and the medicines were prescribed by my mother. So this is a scan taken on 2023 with diffuse grade 3 adenomyosis. And after 2 years, the uterus has become normal. See, in this particular case, if it had been modern medicine, the only treatment modality would have been hysterectomy with bilateral salpingo-oophorectomy. Even when you cut open the abdomen, the whole uterus, the ovaries, the intestines, the urinary bladder, everything would be in a single mass. It would be a very difficult surgery to perform, a life-threatening surgery that could even put the patient in immense suffering even post-surgery. But see what our medicines have done. It has dissolved all the adhesions. So it's all about our medicines can even dissolve the scar tissue. So if this is not enough, see the next case, a case of burns. This lady had a kerosene burn 18 years back, and she had already done plastic surgery at the tip of the chin. If you can see there is a plastic surgery that is marked over there, the patch of skin put by plastic surgery. And if you look at the sides, you can see the contractures. But this is a result after 2 months of treatment. And this case came in the OPD of my mother. She treated it there. And this is the result after 5 months of treatment. See the contracture, it has disappeared, and now the patch that was put on by plastic surgery, it remains at the tip. So we should look at homeopathy in a modern outlook. So it's a very non-invasive, easily palatable, ultra-diluted system of medicine, and it's very economically feasible and with few side effects. So its role in acute or emergency cases should be alongside the modern medicine, especially in cases like cerebral hemorrhage, where these cases which are put for observation, the doctors will put such cases for close observation, and they will wait for the body to spontaneously resolve the hemorrhage that has come in. In such cases, we have got a say. In fractures after surgical correction, in burns after the patient stabilizes, and even post-surgical cases for better wound healing. And even in chronic cases, you can see that in different specialties, a lot of cases that our medicine can cure. In bronchial asthma, in gynec disorders, autoimmune disorders, everywhere. So this is AIMS vouching for our system of medicine. See, the director, Dr. Ajay Singh, has vouched that homeopathy has cured psoriasis in a 21-year-old. See, this is an example of integrated system. And this is a study that came on the European Journal of Pediatrics that homeopathy is better than allopathy in curing pediatric cases. So, our central government has plans to bring in a dual medical degree where the student can learn both modern medicine and Ayurvedic medicine side by side in a 5.5-year course duration. And that should be our motto. Means the complementary role that can be played by our system should be brought in such a model. And nobody can question this thing. So in conclusion, I would say that we need rigorous research, transparent regulations, and integration with the modern medicine, evidence-based modern medicine, to be specific. And the informed choice of the patient. The patient should have the choice to choose the system of medicine irrespective of the healthcare facility. That right to choose the system of medicine should lie on part of the patient. And the emerging scientific arenas with respect to the integrated system of medicine is One Health, which focuses on the health of human beings alongside the health of animals and the health of the environment in which we live. So the recent COVID epidemic is a very vibrant example for the same. And systems medicine is another branch of modern medicine that now they have got that awakening that the human body is not just anatomy and simple physiology. It's a complex interaction of different systems, even the biomolecules. It's like a engineering marvel that you should be wondering at. So now they are bringing in systems medicine where the concept of homeopathy and the concept of many other holistic systems of medicine are brought forth in that the human body as an integrated complex system. And it has anatomy, it has physiology, and it has even got, the mind has got a profound role in determining the health of an individual at a particular point of time. So my suggestion is that the future, it should be a translational medicine where the theoretical gaps are filled in with the modern investigative amenities, and we should be able to correlate the theory with the clinical cases that we see around. And the introduction of dual degree courses is again a welcome sign from the central government of India, and it's a very, very marvelous approach towards the healthcare. And again, we should think of restarting the MF Home course for modern medicine graduates. Previously, it was there in Rajasthan, but now it's not available anywhere in India. So government should again think about it. Because again, I am struggling with the same 5.5 years long BHMS course where I have to spend my time upon the same subjects that I had studied once back. I could utilize that time for the betterment of my studies and for the betterment of homeopathy if such a course was still existing in the medical colleges. And again, starting an Ayush department as they had done in the AIMS, in AIMS Patna, in AIMS Raipur, and in many other branches of AIMS, now they have incorporated an Ayush department, and that is why the modern medicine doctors over there, the director of AIMS has vouched for the effectiveness of homeopathy. So let's hope that it will bring in tremendous change. These are just mere suggestions, and it's up to us to work. It's up to us to go, to rise, and not to stop until we achieve our goal. So thank you.